The current management of transient tachypnea of the newborn is primarily supportive, focusing on providing oxygen, maintaining a neutral thermal environment, ensuring adequate nutrition, and monitoring the infant's cardiopulmonary status. Let us see the place of salbutamol for transient tachypnea of the newborn. TTN is a common, self-limiting cause of respiratory distress in newborn, characterized by rapid breathing or tachypnea and other signs of respiratory distress within the first hours of life. It is caused by delayed clearance of fetal lung fluid from the alveolus. Normally, a surge of catecholamines during labor helps clear this fluid, but when there is factor that interferes with normal process of fluid absorption and clearance, like the lack of labor and elective cesarean section, contribute to delayed reabsorption and lead to the symptoms of TTN. So, late prematurity, cesarean delivery without labor, maternal diabetes, those are a risk factor for TTN. Transient tachypnea of the newborn is diagnosed based on a newborn's rapid breathing after birth, ruling out other conditions with a chest X-ray showing characteristic hyperinflation and a prominent vascular marking, and observing that symptoms resolve within 1 to 3 days. Diagnostic tools including monitoring vital signs and oxygen level, chest X-ray to identify fluid in the fissures and perforated lungs, and lung ultrasound as a sensitive, non-invasive options. But the diagnosis is confirmed where the infant's respiratory symptoms improve significantly by the second or third day of life. Otherwise, the chest is clear, no crackles, crepitations, or wheezing, but the baby is just having respiratory distress that resolves within 1 to 3 days. So, as I have said above, till now, standard management of TTN is supportive care. It is typically managed with supportive measures since it is self-resolving. Supplemental oxygen for hypoxemia, often at concentration of less than 40%. Sometimes non-invasive respiratory support such as nasal cannula or CPAP are needed. And maintenance of fluid balance and nutritional support, often intravenous until oral feeding is safe. And also thermal neutral environment. Antibiotics is given if sepsis cannot be ruled out. When we see the rationale for salbutamol in TTN, mechanism of action of salbutamol, as you know, is it is a beta-adrenergic agonist. Beta-2 agonists are known to accelerate the rate of fluid clearance from the alveolar space by enhancing the activity of sodium channels and the pumps. So, by speeding up this process, salbutamol could potentially reduce the severity and duration of TTN symptoms. Salbutamol stimulates sodium and the fluid clearance. Because it is a beta-2 adrenergic agonist, it activates receptors in the lung cells that promote the movement of sodium and, in turn, water out of the air sacs. It accelerates lung fluid clearance. This stimulation speeds up the absorption of fetal lung fluid, which is the underlying cause of TTN. Most studies shows salbutamol reduce respiratory distress. Inhaled salbutamol can decrease the severity of respiratory symptoms such as rapid breathing and the need for oxygen. It shortens hospital stay. Salbutamol can reduce the total length of time an infant needs to stay in the hospital. In addition, the therapy can also lessen the need for oxygen therapy and other forms of respiratory support. And also no significant side effect. It's generally safe for newborn with TTN with no detected side effect in many studies. But sometimes salbutamol can cause common side effects such as tachycardia, tremor, hypokalemia, and sometimes hyperglycemia. Serious adverse events such as arrhythmia is so rare. So risk versus benefit, or the potential for adverse effect combined with the often benign and self-resolving nature of TTN must be carefully considered. Salbutamol is typically administered to newborn with TTN via nebulizer within the first few hours of life after delivery. Early administration is very important to get a good result. A standard dose is calculated based on the infant's weight. So overall, salbutamol is not currently a standard recommended treatment for TTN, but a lot of evidence shows it is helpful. So due to large certainty of evidence, in the future, high quality evidence is needed. Larger multi-center randomized controlled trials are required to confirm its safety and efficacy. So till now, focus on supportive care, which is the cornerstone of TTN management. Then, in the severe form of TTN, you can start using salbutamol early in the course. Thank you for watching.